Hi, well, thank you for having me here. Anytime I get an opportunity to speak with parents, I love it because one of the things that in our field we really want to train and teach the parents on how to deal with your children's behaviors. One of the things as I go through the slides, you'll see I'm just going to give a little bit of a background. I'll turn it on. Oh wait, this one. There you go. Yeah. So the title is the parent tips for positive behavior management. And that's my company, Shaping Expectations. So I'll give you a little bit about myself. Name is Zaida Torres, and I'm a board certified behavior analyst and a certified special education teacher. As Sylvia had said, I started out the school, and it was a really heavy ABA-based school. We were getting a lot of kiddos, but primarily had to have the diagnosis of autism. As our, yes?
Okay, ABA.
Yes.
Make sure everybody knows that.
Yeah, so ABA is Applied Behavior Analysis. I do have a slide on that. It's so the school is heavy based on ABA at that time, and it's primarily been known for children with autism and all of that. That's how I got my career started. Started as a teacher, and then board certified behavior analyst. As of May, we just opened up a clinical practice. It's called Shaping Expectations Therapy in Lutz, Florida. We serve 18 months to 12 years old. Right now we're focusing on early intervention. We are taking special cases where we are working with the older population. It just requires different resources after a certain age group. We provide ABA services and educational support. We also do tutoring. So I'm also a wife and mother of 3 children. So I understand the dynamics of the family and how difficult it can be to implement some of the strategies we're about to talk about. So the presentation objectives, the material, it is research-based, but I would like to keep it kind of light. It could get very technical in the terminology. So I'm just going to try to keep it very friendly, provide some basic strategies on preventing and how to react to behaviors, and identifying the whys of the behavior. I think that's really important, and a lot of families, that's the question, like, why do they do this? And also dialogue questions. You guys feel free anytime to ask any questions. So applied behavior analysis. Behavior analysis is a science which studies principles of how learning takes place. So through decades of research, there's been many techniques that have been useful to increase behavior, but also to decrease some of the behaviors that we don't want to see anymore. The primary focus is pretty much using these principles to change these children's lives, just more positive interactions with their family and their environment. So what is behavior? Behavior is anything good, bad, or neutral. Anything we do is behavior. It could be as simple as just sitting down watching TV. It could be the tantruming, the screaming that sometimes we kind of have our kids engage in. And it could be just playing with each other and the siblings. So why do kids do stuff they aren't supposed to? That we always ask that. As analysts, we believe that all behavior can be explained. As parents, sometimes we don't see it that way. We're like, I don't get why they did that, just came out of the blue. But sometimes our kids, they act out and we just don't understand why they did that. So here's some reasons for behavior. Sometimes it's getting what they want. It's the positive reinforcement. They're doing this to get what they want, whether it feels good. It could be getting some food, their needs met. It also could just be getting a simple toy or attention from a family member. Sometimes it could be avoiding things they don't want. I don't want to clean my room. I don't want to watch or eat that. So sometimes they could be acting up based on, not getting trying to avoid something. Some behaviors can be due to the inability to communicate the wants and needs. They may have no language to ask for what they want. So a lot of times, the lack of language doesn't mean that they don't understand. They're still trying to communicate, but it's not in the most appropriate way. So they're telling you they don't want that, but it might not be in the no words. It's just behaviorally, this is what they're showing you. I don't want that. So finding out why. In ABA, we call it the function. The why is the function of behavior. So through observation of behavior, we can determine the function, the behavior, and why they do what they do. So as an analyst, what we do a lot of the times, we come into the home and we do multiple observations. We come in, it could be in maybe 3 1-hour observations, and a lot of the times we want to provoke behavior because we want to see what's triggering it and what's maintaining it. So we go in, we ask you, hey, when does he act up? We have to do this. Okay, let's get you to do that with your child so that way they can start either throwing stuff, start tantruming. I want to see what happens and react naturally to it. So how we find out the function, we observe what happened before and then after the behavior. So it's our typical, it's as easy as ABC. Our A is the antecedent, what happened right before. The behavior, what is it that we're looking at? Is it the behavior of tantruming? Is it the behavior of, earlier I was talking to some of the parents, is it the tipping the chair? Or is it the throwing of items? So what are they doing, engaging in before? Are they alone? Are they talking to someone? Are you talking to somebody else? Like what happened right before? And then we want to look at the consequence. Typically, as a general population, we think of consequences as bad things. In ABA, consequence is just the event that happened immediately after that child engaged in that behavior. So we're going to go through just a few scenarios, and so that way we could kind of get a picture of the behavior, what happened before, and the consequence. Any questions? Is everything good? So, great. So here's an example of an avoidance. Joe hates baths, so you go tell him, take a bath. Joe cries and throws himself on the floor. Now Joe gets to avoid taking a bath for 5 more minutes. This crying, sometimes it could last 5 minutes, it could last half an hour. But Joe, what is he doing? He's getting out of taking a bath. This is the function here, is he's avoiding it. I'm not taking a bath, I'm here crying, and you're probably engaging, no, come on, or coaxing a lot of the time. Or sometimes you may just let it go. You know what, I'm not gonna deal with this right now. I have to go feed my other child or go finish up dinner. I'm just not gonna do this right now. So that does happen. Another example of maybe getting something good. So Jane, she's playing with her favorite toy. Her parent says, okay, let's put the toy away. Jane starts whining, and then the parent lets Jane have the toy a little bit longer. So in this case, we could see that Jane, she didn't say, can I have a little bit more time to play? But she's communicating in her whining that, I don't want to put this away. And the mom's allowing, though, the whining, in this case, to get Jane a little bit more time. So can anyone tell me maybe something that we could possibly teach Jane to do instead of the whining? They want more time, yeah. So there's different strategies, and when you get someone to come into your home, for example, the nonverbal child, we may actually start doing some of the picture stuff, or even like the communication tool, where do you want more time? More time, more time, and we're reinforcing that. So we could give them a mode of communication. One of the kiddos I was actually working with, hitting was a big one. It was huge, and that got a lot of attention to, I want to do something. So we started with baby steps, and the baby step was just a touch. And that touch to me and to the parent now meant I want this item a little longer. So we started shaping that, and eventually we got into actual like a picture communication because this child was nonverbal. 12 years old, we were a little bit beyond where we can do some of the vocalizations, very monotone vocals. So in this case, we were able to kind of shape that, and the hitting stopped. So this very aggressive hitting just to get extra time with something or the access to something, it started reducing. It does take a lot of time and a lot of energy, it really does. But we can find some replacement behaviors. One of the take-homes from that I was trying to go with this is that our kids, no matter what they're doing, they are trying to communicate to us. They're trying to communicate something, whether it's I'm bored, I want something, and it's just giving them those tools to kind of move forward and move ahead with that and actually make it more appropriate. So this is another example of getting something good and avoiding something. So Johnny's playing outside. His parent says, it's time to come inside and clean your room. So Johnny runs away. Johnny gets to play outside a little longer, and he doesn't have to clean his room yet. So this is something where not only do I get something I want, but now I don't have to listen to mom. So how are these examples similar? In all of these examples, the child, they are communicating, but it's nonverbal behavior. They're not necessarily telling us, no, mom, I don't want to clean my room now, or telling you, no, I don't want to take a bath. They're acting out to tell you this. And as a parent, a lot of these situations, the parent is allowing that acting out to occur for that child to get their needs met. So we could say a lot of things without speaking, but the thing is it appropriate? So challenging behavior as communication. So what if your child does know how to ask or ask for what they want, but still acts out? Sometimes just because a child has a few words or some communication, I get a lot of kids where they could sing the alphabet, they can sing all these songs, but then they won't tell you like no or I want something. They just won't. So sometimes just because they can have the ability to do it, they might not know how to do it in this context. So we have to train that. It's possible that's easier for them to do the inappropriate behavior than to actually ask. So crying or whining, that might be easier than actually trying to tell you or using a communication device to tell you this. It's just easier to whine. I'm going to get what I want anyhow. Often parents, including myself with my 3 kiddos, we're more likely to give the child what they want when they do something inappropriate than when they ask nicely. So in these situations, you see this sometimes with the siblings where they'll start asking just politely, Mom, can I have this? Mom, can I have this? And it starts getting louder to the point where you're yelling, yes, you can have it. So we didn't respond to that child when they were asking nicely. Now they got us to the level 10 and now we're responding. So as parents, sometimes we have to change our behavior so that way the child could change theirs. So why do we do this sometimes as parents? Parent behavior. So from experience with my own children, parent behavior serves the same function as the child. The way we interact with our kids allows me to access good things and sometimes avoid bad things. So what can be the good things for the parent? Seeing your children happy makes us happy. Seeing sometimes for us, I know as parents and you guys have very challenges going on, that it is, sometimes you just don't want to deal with it. So it's just easier to give them the electronic or just let it go. It's easier. Sometimes, so what can we do? What can be bad stuff for parents? So seeing your child unhappy, sometimes I just don't want to see them cry. I don't want to see them sad. And dealing with problematic behaviors like tantrums, it can be exhausting. It can be exhausting, especially when you've had a long day at work, you're coming home, you really don't want to deal with the tantrum. So I'm going to take the scenarios, and we're going to look at both the child behavior and what the parent gets out of it too. So in this case, it's Joe, same thing, bath. He throws himself on the floor. So not only does Joe get out of the bath time, but the parent also, you know what? I'm not going to deal with it now. I just want some quiet time. They get out of the bath and you get quiet time. So that behavior is they're controlling your behavior as well at this point. They're going through your behavior. So the parent perspective on Jane. So it's time to put the toy away. She starts whining. The parent avoids seeing Jane unhappy, and she lets her have the toy a little bit longer. So at this point, the whining, I feel it's making her sad. I don't want to make her sad. I just want to give her the toy. And Jane gets a little bit more time with the toy. So this whining behavior is not only kind of manipulating my behavior, it's like I'm not sad anymore because I'm giving her something she wants, but she kind of gets to play with the toy a little bit longer. So challenging behaviors. People do what they do to get something they want or they need out of it. Would your child keep doing the problematic behavior if they didn't get what they want anymore? So one of the things as an analyst when we go into the home, we give you different strategies so that way we can put that behavior on extinction. So what extinction means is pretty much that we are no longer going to reinforce it. And by reinforcing, it's based off of those functions. Is the child engaging in the throwing behavior for attention? So is that the function? So that serves as a reinforcer. So now I'm going to go in and tell you, I don't want you to give him attention when he throws stuff. But we're going to provide attention for the other good stuff he's doing or when he's not throwing. Would your child keep throwing if it was maintained by attention? In this case, they would not. After a while, they start learning like the throwing is not going to get me what I want. But they'll find something else to do. As children, they will find something else to do, but as analysts, when we come in and as parents, we try to teach them more appropriate behaviors. Earlier when I was talking to one of the parents too about the throwing, I've had kiddos that that was one of their behaviors, they throw. They like to throw everything. When they throw stuff, so I stop reinforcing or giving them attention for throwing the objects they're not supposed to. We give them a replacement behavior. We're going to go and now we can throw this ball in a basket. So I'm going to teach them something that they can do that's appropriate, and when I'm going to give them attention and be playful when they're actually doing it in an appropriate manner. So the same behavior can be shifted over to something appropriate rather than inappropriate. Do you have any questions so far? Yes.
The challenge that we face with communication is that we really haven't in 12 years found even one effective method of communication. And I think we're trying to so our challenge is that sometimes the behavior doesn't necessarily start when our son doesn't get what he wants, but when he can't communicate to us what it is that he wants. He has one son, and that's more. So he'll say more, and that means he wants something, but there's a million things that it could be. And so when we can't figure it out, he's upset, he's frustrated, which is understandable. But if we just ignore the behavior, then we're kind of also ignoring his need at the time.
Yes.
What's your advice for parents like us whose child really doesn't have that communication to where we can say, well, ask me in a nicer way, and then, you know, so.
Yeah. So typically with family, when I start with kiddos they don't have a lot of things to communicate. I start off with something small. It could be as simple as a playtime, if they're actually engaging in appropriate play with something, or it could be as simple as a snack time. So depending on the child and the child's ability level, there's different strategies. It seems like he may use sign, but he might not have the full dexterity to do other signs. So I may use some sort of like picture exchange at that time, where I put an icon of whatever it is that child, we're having a snack, and let's say it's Cheetos. And I might put an icon on a communication board, and then for that time, I'll train the child a few exchanges of, if you give me that icon, you get some Cheetos. So it takes a lot of initial training of the child to understand that this means that. And providing those opportunities is really important. Obvious language is very broad. There's a lot of things in our environment, and there's probably a lot of things your child likes as well. If we start off with just a few things and really focus on those, and we take these baby steps, we can broaden what they're asking for. So if we get really successful with maybe even 3 items, they start understanding that there is something I want, and now I'm going to try to figure out how to communicate that to you, whether it's by pictures, or I've had kiddos actually generalize that with the actual object. Like they'll come over and it's a thing of bubbles and they just give it to me. And a lot of our children, we don't realize there's these prerequisites where it's, as typically developing children, you start with like the pointing or the pulling. Some of those kiddos don't display those behaviors. We may have to show them that, like, this is what that is, like, thanks, and they pull you, you know? So you could start off as simple, like during snack time or even TV. I've done it with the kiddos where their favorite show, where I turn it on and off, and then I have them exchange that picture to me, like, oh, on, and let's turn the TV on now, and giving them as many opportunities as possible to communicate that to me, yeah. So you could start off simple as that. I would definitely consult, like if you have access to a speech therapist as well, because they have access to all those, those tools pretty much to be able to like give you these pictures and print them out and laminate and all of that, because it could be very labor intensive. And this is where these other professionals also can kind of help you with that as well, and putting something like that together. So sometimes, and those are strategies like that we focus, and it's part of that A strategy, where it's the antecedent procedure. We don't wait till the behavior occurs before we start reacting to it. We want to make sure we're giving that child those tools so we don't get to the behavior. Yeah. So what if they were able to get something, or what they want for doing something more appropriate? And in that case, it would be that, like, I could get something I want by just an exchange of this picture. So what if the appropriate behavior got them what they want and was easier than the problem behavior? You think about it, tantrums, crying, and all this, they're exhausting. It's not easy. But if I could find another way to communicate this same thing to you, and it's easier than doing all of that physically, I'm gonna more likely give you this picture to ask for something. So this is a case study. This was a child, not a child, it's actually an adult. They're all children to me. But this is an adult that I worked with. He was in a group home. He's most of the population that I've worked with primarily diagnosed with autism, with some comorbidity of other diagnoses. But in this case, James, he was a 19-year-old man with autism. And in this group home, he would hit others. He'd bang his head against the wall, he'd hit himself, and he'd also disrobe. James, he could do about maybe 2 to 3 word sentences, but not consistently, not as often. His main form of communication was honestly engaging in those behaviors. So when I came in, did an observation based off of our functional analysis, it turned out that most of the behaviors he was engaging in was to escape from work, so he's trying to get out of bad stuff. And most of the work were chores around the group home that they had to do. And attention from others, getting good stuff. So every time I hit others, bang my head, or disrobe, I get multiple staff coming to me. So why did he need to be destructive? Because he didn't know how to ask for things, and he didn't know, when he did, his staff would often ignore him. So at this time, before we got in there and we were able to train the staff, often when he would say something, no one would respond to it. It was just, they would just ignore that, or they would acknowledge it but not follow through with what he might have asked. So what we did, we ended up teaching him how to ask for breaks. So this is that antecedent. We were trying to give him those tools, what to do before he gets into the behavior. So we taught him how to ask for a break from work. I need a break. We trained the staff to give him more attention frequently so he wouldn't feel the need to be destructive in order to get it. So if he's doing this for attention, we want to make sure that we're giving him attention not when he's engaging in problem behavior, but throughout the day. So if James was hanging out with another peer, maybe playing a game, we had two staff members come over and praise him and give him high fives for engaging in something appropriate. This would occur throughout the day. What we end up using a lot of times are kind of like these timers, and it would just vibrate like on an interval of 15 minutes, and when that went off, it's time to go give him a pat on the back and say, hey, good job, James, like you're doing a really good job sitting here, or playing. And that kind of kept the staff going, like reminder, I gotta go make sure he's doing okay. What else did we do? Oh, we trained also the staff to ignore the destructive behavior to a point. We can't let him run around the house naked. So there was to a point where we kind of made sure that there wasn't an audience around when he was engaging in these behaviors, and making sure that when he did just kind of hit himself, it wasn't that hard, it was more so towards others, that we just block, but we wouldn't make a big deal about it. We wouldn't say, stop hitting yourself, you know, and we wouldn't kind of, why are you doing this? Engage in that dialogue with him. We just left it alone, blocked, and not provide any more attention than we need to. Yes?
Does that go for hitting others as well? Because we usually stop them and say, don't hit, show gentle, you know, be gentle instead.
Yes.
But it doesn't seem to work because he still hits people. But, you know, I don't want the other child or adult to be like, why didn't you correct him? You know, like, why are you allowing him to hit me? Because I do stop the behavior, and I always communicate with him and say, you know, don't hit, we show gentle. What are your thoughts?
So in that case, if every time you're telling this child, it goes back to the function. So every time you're telling this child, don't do that, you're providing attention for what he did do. So one of the things I would focus on are those pre-strategies. What are we going to do before we go to the playground? If that's when we know he's going to most likely hit a peer, is when we're in a public place like the mall playground, or just in the playground around our local community. I would just go over, all right, what are we gonna do? We're gonna have nice hands. Just remind them of what we do, and then maybe a little something of what we get if we do that. So I'm going to just go over, set those rules. We're gonna have nice hands, we're gonna play, we're gonna have fun, and then afterwards we can get whatever special treat. It could be even just access to the phone if that child is what they desire. Go over that. If they hit a peer, I would remove them immediately. If it is attention maintained, remove them immediately and not provide any more attention than I need to. That is not the time to talk about it and reprimand the behavior, because anything we do right after the behavior is only going to reinforce it. So I would talk to them later. Okay, when we play with peers, what do we have? Nice hands, and not go on the don'ts. So a lot of the times what we say is, don't hit your friend. But the thing is, we're not telling them, what do we do?
We're always like, use your words, because he can say hey.
Yeah.
And he screams hey, but not when he really wants to talk to someone, especially a child. He'll just go up and hit the child. And so using his word hey, you know, he can say hey, but instead he'd rather hit them. And so it's confusing.
So what I would do, I definitely consult with a local professional, so that way they could review the behavior, do an observation. But personally, what I would suggest would be to just kind of remove them quietly, sit them out, and then, okay, we want our friend's attention. What are we going to do? We're going to do this, and then go over and model it with him, even if it's like a full physical model, like hey, and then we can provide him attention. So a lot of times practicing it over and over, or he's more likely to get the attention that way too. And now I'm going to have multiple opportunities to practice what I need to do rather than what I don't need to do. Yeah. So that's a really important part, kind of like with the communication, is the practice. The more opportunities they get to practice the good behavior, the more likely they're going to do it in the future. If we only get that one opportunity where we're told no and then do this, there's not enough opportunities for learning, really. There's just not enough. So back with James, one of the things that we also ended up doing was, so in summary, his behavior, he didn't get what he wanted, and then the adaptive behavior, he got what he wanted when he learned how to ask for things. It worked, yes, but the big thing here is that it had to be when the staff was consistent. And that is very hard. As parents and as staff members, the consistency can seem daunting and exhausting. So when the staff didn't give him enough attention, his behaviors would come back. A lot of the times when I tell the parents, we can't fix all the behaviors at once. I would focus definitely on one at a time. And then really go and be consistent as possible with that one behavior. Because when you try to target all these behaviors, what you end up doing is failing at all of them and possibly reinforcing those behaviors to become even stronger, because now not only did you kind of provide me attention, but you get kind of mixed signals, like sometimes I get this and sometimes I don't. So picking that one behavior and how to reduce that one, or teach them something else, focus on that and be consistent with it. And if you could find that and be consistent and make those baby steps, you're gonna get a lot further than trying to just target everything. So a recap in this area was that whenever the child wants something, they have two choices. They either could do it in an appropriate way or inappropriate way. One of our ways as parents, what we need to do is provide them with, or guide them really, to make the choice the appropriate choice. So we're gonna give them something they want for good behavior, and we don't give them anything that they want for the destructive behavior. So we make it easy for them to make the good choice. At the end of the day, you don't get what you want by acting like that. We have to do this. So we're giving them choices. Those are your choices, but you get all the good stuff when you do this. So some simple strategies for using reinforcement. One of the things, I just want to do a disclaimer, a lot of the families we work with and every child we work with is completely different. What may be reinforcing with one child may not be for another. Some children do things for attention, and then some kids do it completely it's sensory-based. So it's not a one-size-fits-all interventions or strategies. I would definitely contact a local certified analyst to make sure that they observe the behavior and give you actual functional analysis on it for a behavior plan, and then be able to kind of teach you and go over that. So some simple strategies for escape or avoidant behavior. So if you notice that they're trying every time I do this, they do this, they get out of something. A few things is you could use that first then language. So I think it was Joe's example. It was, first bath, then TV. TV is something we know he really, really likes. We're going to put on his favorite TV show, but first bath, then TV. Some parents do have a hard time transitioning to the bath in general. So I may even pair the bath with something fun. I may put up the iPad with their favorite show. Like, look, we could get to watch this while we're taking a bath. So that way they get to pair that, like, oh, it's something enjoyable I like with something I really don't like. And they start making those connections. And then you can start minimizing the time that you have the little pad up and then kind of like put it away. So essentially the bath time becomes something more favorable than kind of just, I have to be, dragged into the bathtub every time. You could teach your child appropriate ways to ask for escape. So this could be as simple as if they are using sign, teaching them to break, asking for a break. Or if they're using a communication device, making sure to facilitate that and have it up where if they want to get out of something, it's going to be easy for them to just touch that icon on there. Or even just asking verbally break if they're capable of doing that. One of the things too you could do is breaking down tasks into smaller feasible steps. Actually my husband did a great one with my girls. They go in over the weekend, make a huge mess in their bedroom with toys, but then they don't want to clean it. So he went in and he actually, I love this part because I'm like, oh, you're using ABA. He came in and he's like, all right, guys, so you're gonna clean this section, and then you guys get to go play with. They like to do this like Minecraft. They like to play Minecraft. So he's like, okay, clean this section, then you get to play Minecraft. Then you come back, clean this section of Minecraft for 5 minutes. So at the end, it took a little bit longer at first, but they got their room clean without arguing with all those problem behaviors. So sometimes just breaking down something that may seem difficult and just overwhelming for that child, breaking it down to small pieces and rewarding these little gains that they're doing, essentially you'll get it done, and then over time you can increase the amount of time. For example, the cleaning the bedroom. So long term, he can ask them, which now they actually do. It's like, here, clean half the room, then you get a break, and clean the other half, and then you get a break, versus these little sections that he was doing before. And provide them with choices. And it's one of those things where we provide them with choices, but they're under our control. So it's for example, the bath time. We can ask them, do you want to take a bath or a shower? just providing the child with these choices can be the point to where it's a trigger, really. If we just give them, no, you have to do this, versus here you go, pick one. Which one would you like to do? At the end of the day, we're meeting our goal of them actually getting clean at that point. Yeah. So this could also go with feeding. If a child has difficulty with certain foods, and it's just providing them choices. What would you like? Pick one, and you might give them those healthier options instead of just the one option. Nope, you got to eat this. So some simple strategies for attention-seeking behaviors. So if we notice that that's what our behavior is, that it's all for attention. Providing attention periodically, just like in the case study with James, where I had the staff use the timer just to periodically give them the attention every 15 minutes. Later on, we were able to do it up to like 45 minutes because he was getting enough attention throughout the day. But just giving them attention when they're actually doing something they're supposed to. And this goes with catching them being good. A lot of times as parents, we get really busy during the day, and especially when we get home and we're doing, cleaning after the kids and making dinner, that we kind of just forget to provide our children with attention. So one of the things is just making sure you're catching them being good, and they're not only getting attention when they're doing bad stuff. Like, this is the only time I talk to them. Only give attention, to good stuff, and kind of downplay, and don't bring attention to the negative behaviors. So this goes back to kind of like the hitting at the park. So we don't want to only talk about it at that time, right? We kind of want to downplay it. Okay, well, we don't hit, but later on you can talk about what we're supposed to do rather than the don'ts there. So we want to kind of downplay what they're doing wrong. If they cry or tantrum for attention, removing yourself sometimes may be a better option. And this is if you can. Some children, you cannot leave them alone or unsupervised. But sometimes just kind of removing yourself, and as a parent, it is for your sake of mine, so sometimes removing yourself will kind of prevent that possibly yelling, the attention that they may be seeking for. Some kids, although we may not like getting yelled at, some kids the attention of any kind is attention. So whether it's yelling or telling them good job, all of it serves the same function. It's attention. So this is where we want to make sure that differentiating between the attention. Like, I'm not going to yell. I'll just walk away. So a lot of times you'll see the children, they'll actually come up to you. Like, if it is attention seeking and I kind of just walk away, pretend I'm doing something, they'll come over to me and actually grab me, like, hey, you're not looking at me. Look at me. So you start noticing that, and then they'll start differentiating between that. I only get attention when I do good stuff rather than when I'm on the floor tantruming. And if it's not feasible to walk away, you can make yourself look busy or talk to your partner. We talk amongst yourselves. So, and we won't talk about the problem behavior, like, oh, Johnny's tantruming again. What we'll do is just talk about our weekend, talk about what's for dinner, and that way that child is not getting the attention that they're seeking for at that time. Some simple strategies for getting access to something. So I thought this was a cute icon. So a lot of times this does happen. Cry, give them a cookie, right? So providing access to items periodically, not when the problem behavior is occurring. So giving them access to a favorite toy or even just a snack when they're not engaging that behavior, it'll kind of make that, it won't make that association that I have to cry to get a cookie. Teach them appropriate ways to access that cookie. This is where that communication comes in. If they can communicate, there are different modes of communication, and it's just training that communication and giving them multiple opportunities to be able to practice that communication. Don't give in when they're having a problem behavior. So this actually just makes things worse. So if the child is crying for the cookie, and we're at this time we're not reinforcing that, they could cry up to 30 minutes. I've had kids cry I've had sessions as long as 4 hours and they're crying just for that cookie. That's how much they want that cookie. But that crying has been very, very, very effective. that it will get worse before it gets better. But yes. So one of the things is don't give in. I always tell the parents, don't give in at this time. This is not the time to give in, because now you just taught that child that you have a threshold. And I will break that threshold. So if they can't access it, redirect into something else. So sometimes too, redirection can be a beautiful thing. Some people are really, really great at it, and sometimes it's hard to redirect. I understand that too. But for example, if the child really wants that iPad, maybe I could redirect them to another highly preferred toy. Like, oh, that's not available right now, but this is. So giving them that choice rather than saying, nope, that's not available, and leaving it at that. Because now I don't know what I want to do. This is what I really want, but I don't have access to that. So we can offer them that choice. Like, this isn't available, but this is. Creating visual schedules of when they'll have access to it again. So a lot of times our kiddos, when we do take something away, it's kind of the end of the world. So when am I going to get it back? I don't know when I'm going to get it back. Am I ever going to get it back? So sometimes having some sort of visual where it's like, okay, first we're going to have dinner, then you get to have access to whatever it is that they want. That could be preventative. And for that child, okay, this is all I have to do to get that. So it kind of brings that sequence of events. So helping yourself change. So as parents, it's really hard to change stuff that we've been doing already. So now, you have some tools that you're able to identify maybe the child's attention or behavior, why they're doing what they're doing. So we could change some behaviors. So helping your child learn new behaviors requires your behavior to change first. So how do you change your own behavior? First, we have to accept that what we're doing isn't working. So that's the acceptance. We have to commit. It's a huge commitment, but with the commitment also comes the progress. And we have to persevere. One of the things is that behavior doesn't change overnight. Like, you can't change something that's been going on for years in 2 days. You just can't do it. So with acceptance, if you decide your child's behavior needs to change and it's not getting better, there are two things that need to be accepted. That what you've been doing doesn't fix anything. It's not working. Therefore, something in your behavior must change. So we don't want to bother changing anything if you're not willing to change. That's one of the things. When I go into a home, I talk to the parent and I try to see their overall goals. What are they looking for? And we start I break it down to what's most important and what they're willing to change. There are some things that the families aren't willing to change because, you know what, I have to get all this stuff done and they have to take a bath, so I'm not going to change that right now. So we might focus on something as little as, okay, we're going to focus on communication, on just asking for a break. Let's do that, and let's start there. And we can start very small. When we see some progress with that, maybe we'll go into the bigger stuff that might be more challenging for your day. Commitment. So you've decided that you're doing something that isn't working. Now what? It's time to commit to doing something new. If what you're doing right now isn't working, the only thing that makes sense is to try something new. So good behavior procedures, good behavior produces something he or she loves. Problematic behavior does not, and we start small and easy. Like I said, what we first start and do is to start with something just small. It could be as simple as, like I said earlier, just requesting for something preferable, and go from there. I've had kiddos that have had tremendous problem behaviors with tantrums, hitting, and self-injury. If that's the primary focus, what we're going to do is we're going to focus on what the attention is, or what the problem is, and then we're going to provide attention to different other areas. And we're going to see what the parent can do. I coach them throughout the session, and from there, I do a fidelity check and I make sure to follow through with that. And then I give them feedback, like, okay, let's try this way. So you want to make sure that what we're doing is actually feasible for the parent and that we're making also changes in the child's behavior. And perseverance. Behavior change, it can be difficult, and it can be difficult for both you and your child. It's really hard to see your child go through all of these problem behaviors, tantruming and crying. And sometimes it's just not easy. That doesn't mean that you're doing something wrong. It's just part of the process. The problem usually does get worse before it gets better, and it's typically because what they've been doing has been working for so long. So you got to hang in there. If you want it to work, you have to be consistent every time. So this often goes for both sides of the parents. Sometimes mom is very consistent and dad kind of gives in, or vice versa. And when there's siblings involved, it could actually be the siblings giving in to the child. So they're getting it from someone, and that's who they're going to go to. So a lot of times what we do is we end up having team meetings, and if the child's old enough, the siblings are old enough to train, we'll also kind of practice with them too. Like when little Johnny's doing this, this is what you're going to do. And making sure that we're kind of rewarding them too for helping mom and dad out with that. Give it at least a week. So I put a timeline in here of at least a week. Some behaviors take longer than that. But definitely you don't want to just try it one day and give up. Like, oh my gosh, this is never gonna work. This just doesn't work. When is this child's behavior gonna change? Like, why do they keep doing this? But you have to give it some time, just like anything. It's kind of like when we're habit training or we're going on a diet or getting on a new exercise routine. We can't just go to the gym one day and expect for, to have the body we want. Like, we have to continue with the routine and regimen, and it takes time. It takes time. And if it doesn't work, we definitely want to come up with a new plan. So sometimes, when we were talking earlier, one of our parents was saying how she tried something for a while and it wasn't working. One of the things as an analyst when I go in, if something isn't working past the point of 2 to 3 weeks, we're going to change something in there, because that just is telling me that maybe what I identified as being the why they're engaging might not be the why. They might be getting something else out of that. So it's definitely, you want to make sure you're changing it, because then we may be reinforcing something else, or maybe even provoking new behaviors at this point. Yeah. So medical considerations to problem behaviors. A lot of our children have medical issues also with the problem behaviors. This is a huge consideration that as analysts we go into the home and take that into consideration. For about a year ago, I was doing a grant with the St. Joseph's Hospital, and a lot of the kiddos that we were getting, they had multiple medical situations where they had tumor in their lung, and they had different things going on where I couldn't let this kid just tantrum. They were not going to be able to breathe. I was going to be hospital bound at that point. So one of the things that we want to make sure is always I consult the physician. I definitely collaborate with their primary care, PCP. And one of the things I do, I focus on the prevention and the teaching rather than that consequence base. So I'm going to make sure that I'm providing enough opportunities during the day to teach rather than wait for that behavior to happen, because now I don't have a choice but to kind of give in and try to find a way to fix that so that child doesn't go have an episode where he may have to be hospitalized. So that's one of the things that we really have to take into consideration. Like, is this a fight worth fighting at this point, or should I just teach it before it even happens? Let's teach it before it happens, especially if there's a lot of medical stuff going on. So this is just some resources. You can find BCBAs through the National Board website. There's about 25,000 BCBAs in the entire world, so it is a very small field. But a lot of board analysts also, they do like telehealth and telephonic communication and training to parents, and they provide consultation that way. But you could definitely go on the BACB website and just find a certificate to kind of help out that could possibly be in your area. We're very fortunate here in Florida. We're a huge ABA state. I lived in Texas for about a year, and I didn't realize how there is no ABA there, and the strategies that they were using were very reactive. And actually, it was very sad to see. Yeah, and I was in shock. Yes. I went to a therapy place and they were just tying kids down for speech therapy. I was just like, oh my gosh, no, like there's so many other things you could be doing and more positive. So it was very interesting. And one of the things that as as analysts that we're trying to do is just disseminate and try to get more people trained in these positive approaches, where you can get the same results without having to be so punishing to that child. Yeah. One of the things, so I know that primarily right now, ABA is provided to people with autism. That's the big one. And a lot of these other diagnoses, if you don't have that autism label, you may not be eligible for ABA with your healthcare provider. So I did a little bit of research. These are some websites that I just found locally, and I think one of them is in Texas as well, where it's grants, and they provide funding. It's not a ton of funding, but it's some funding to get ABA services. What I do encourage parents is to look up at the different organizations and be able to apply. Some of them do have limitations with household income, and some of them do not actually. They just look for other special needs as well. In Florida, we have also the Step Up for Students, which this one is for private kids that are in private schools or homeschooled. They get this extra funding and they could use it ABA for speech, OT, or any other therapy, or equipment that the child might actually need as well. So, see you guys, and that was it. I know it's very brief. Overall, I just kind of wanted to give everybody just a general idea, kind of what's behavior, and a few strategies. And like I said, it's not one size fits all with the strategies. I just wanted to kind of leave it open to you guys, ask any questions with any specific questions that you guys may have. Yes?
Really a question of our statement that may or may not be helpful to other people here. With Dennis, he had some behaviors that were really consistent, pinching, tipping chairs and trash cans, going after people's shoes, and no matter how much we redirected, he had to do it. So after years of us thinking that these were just very aggressive defiant behaviors, he was diagnosed with OCD. And so when we found that out, we were able to treat him for OCD, and now that we're able to differentiate which behaviors are impulsive and which behaviors are defiant, it's helped us a lot in managing his behaviors. And I think that Mateus probably isn't the only of our kids that have OCD, but the pension was a big one because we were just covered in bruises and horrible. And now it really doesn't happen often at all. But it was a big deal for us to find that out because it was like we have this answer that he's not just fighting us all day. His brain is, he can help us. This is amazing. So just in case that might be helpful.
How was he diagnosed?
His neurologist diagnosed him after years of us coming to him with every visit, like, so what's happening?
Yeah.
And finally he said, I think he has OCD, and let's try to treat that. And so we did, and what has helped out of everything we tried to do for his OCD, because in CDD, but I imagine with everybody, it's pretty different.
And that's one of the things that as ABA therapists, when we go in, is we take a lot of data. And when we start changing programming, if it's not effective, we do encourage you to go to your physician, because some of these behaviors it's not behavior, it's not something that's been learned, but it's something internal. It may be something that may be affecting them. I had a little girl where she was actually doing the same thing, where she was pinching, and she was having these tantrums, but they really weren't identifiable what was going on. What we ended up finding out was we tried a few treatments, and I was like, you need to go to the doctor. I do think it's something else. And she ended up having celiac. And what was happening, what the doctor explained was it was what she was eating. It was kind of just sitting there like a big rock. So of course she was uncomfortable. She's nonverbal, 4 years old, and she's uncomfortably tantruming. She's hurting. And we didn't know that. As soon as we were able to get the medical diagnosis and get treatment, the behavior tremendously reduced, and we were able to target and teach other things from that point on. Yeah, so that's really huge. We do focus a lot on the data, and our data kind of drives our decisions of where we go as well. Yeah, but that's a great one.
So, same thing with perseveration. Would you say that's more of a, because Ari has constantly has to have something, and we try and redirect it to something that's more sometimes age. I mean, he used to go to school with a million stuffed animals. Walking through a high school with like stuffed animals is a little embarrassing. So, you know, we've moved on to sometimes foamies, and sometimes it's or a box of crayon. Like every day, you just don't even know. Like sometimes it's today is a bag. He likes the feeling of bag, but it's constantly something in his hand, and he just fixates on it. So, I mean, that might even be like an OCD thing. So, it's the fixation of the constant, and no matter how we try and pull something out, he's got to have something else. It's like this constant need.
Yeah, and it could be. One of the things that we've found out, and there's actually a little bit more research going on right now, is especially for autism, sometimes anxiety gets it's underdiagnosed. Actually, there's a lot of anxiety with the autism, and this is what's provoking some other behaviors as well. It could be similar. You know, I'm not really sure on the research with Ring14 and possibly OCD behaviors. It could be something that's very common, and it's just not diagnosed because these other disabilities are kind of overlapping. Yeah. But we're seeing a lot of research because we're getting a lot of kiddos that they're older and they are verbal, but they're engaging in these behaviors, but it is more anxiety based. And once they get that anxiety diagnosis and they get treated for that, we do start seeing that behavior therapy and the medical part of it together helps them out. But now, you know, it was anxiety this whole time when it's not really behaviorally maintained. It's something more internal. Yeah. So it's really interesting as we grow as a field. One of the things too I definitely recommend is if you guys, since you guys are coming from different parts of the country as well, is to look at your local universities. There are a lot of students that look for research participants as well. The more research we have outside of the field of autism, the more availability for these kinds of therapies that can occur with these other diagnoses as well, not just autism. And that's why there's been so much, it's ABA is really related to autism, but because there was so much research on it. But you can use ABA across multiple disciplines. It's been used with addiction. It's been used with PTSD in the military. So you could use ABA across your daily life, really. It's just all based off of research, just like everything else, yeah. And where the funding goes.
Do they come to the school, or like if your child is school age, do they go to the school to do ABA therapy, or is that something they do once your child is home?
It depends. It depends on health insurance and depends on your state. Right now, as of about 2 years ago, Florida is now allowing ABA to go into the schools. But it also depends on the school. If the school has an ABA therapist, then they'll provide it, and if not, they will allow an outside ABA. But most of the time, we go wherever the problem behavior is. So whether it's at the school, at the home, in the community, we've gone to theme parks, we've gone anywhere that child is going to have a problem, that's where we're going to go train. Yeah. I love Georgia.
So, first of all, I want to thank you
Yeah.
for